In this brief lesson, we will discuss how to use brainstorming, problem solving, and role modeling. So the objectives for this lesson are to define what problem solving, brainstorming, and role modeling are, and to provide techniques to conduct them with my choice participants. Here are the definitions. Problem solving is the process of working through details of a problem to reach a solution. It's the process or act of finding a solution, where brainstorming is a spontaneous group discussion to produce ideas and ways of solving problems. It's a technique to solve specific problems, collect information, stimulate creative thinking, and develop new ideas. And role modeling is a person who serves as an example, like you clinicians, for others, like the participants, by demonstrating a behavior or a role for another person to copy. So here's our first checkpoint, true or false. Problem solving is the process of working through details of a problem to reach a solution. The answer to this is correct. Problem solving is a process of working through details of a problem to reach a solution. Next, we'll discuss problem solving. All problems have two features, goals and barriers. Problems involve setting out to achieve some goal to avoid a situation or event. It is simply anything you wish to achieve. It also involves overcoming barriers that prevent achievement of a goal. Here are some stages of problem solving. First, problem identification, recognizing there is a problem, then identifying and defining the problem. Then you need to structure the problem through observation, fact-finding, and developing a clear picture of the problem. Then, looking for a possible solution to generate possible courses of action. And making a decision, analysis of possible actions, and selecting the best solution to implement. And then you implement, carrying out the chosen action, and then you monitor and provide feedback because you're reviewing the outcome of problem solving and the chosen strategies. Problem solving occurs in a cycle. First, you ask the participant to recognize and define the problem. Then, ask the participant to select a strategy to resolve, reduce the problem from a prepared list of evidence-based strategies. That may be using our Aging in Place toolkit. And then you include the strategies on the person-centered plan of care. After you begin to enact a strategy, you need to monitor progress over time and evaluate if the strategy selected is working. If it does not work, you ask the participant to select another strategy to try. The reason it's called a cycle is that once one problem is resolved, another problem usually pops up. This is particularly true with my choice participants who usually have several underlying issues and problems. So next we're going to discuss brainstorming. It is common for professionals, like the clinicians in my choice, to use brainstorming regarding the person-centered plan of care and how to best work with participants. It's also very helpful for each of the professionals to brainstorm with the participant and among the team. Here are some key parts of brainstorming. Brainstorming is the most common type of idea generation. It's relaxed, informal problem solving, and it encourages creative thought and ideas. These ideas lead to new ways of looking at things and helps people who are stuck to solve problems. These ideas lead to new ways of looking at things. There are no criticisms of ideas, no judgments in brainstorming. So brainstorming focuses on quantity of ideas rather than quality in the beginning, like what are all the possibilities? It explains the purpose of the discussion to the participant. And when brainstorming, it's when you sit together and think out loud with the participant and lets them speak at will about what they think may help them. At the end of the discussion, you clarify and combine ideas and come to a decision or conclusion regarding selection of strategies that may help them reach their goal. And then you include that strategy in the person-centered plan of care. So here's another checkpoint, true or false. Brainstorming is the most common form of problem solving. The answer to this is true. Brainstorming is the most common form of problem solving. So next we're going to discuss how clinicians role model activities so that a participant has the skill when you're not in the home. Here are several examples of how to role model for a participant to problem solve or brainstorm if they have a health need. You could role model how to use the Aging in Place toolkit to identify strategies that may be effective for a specific problem or issue. Clinicians are not in the home all the time in my choice, and the participant or the caregiver need to understand how to independently conduct problem solving and brainstorming techniques for day-to-day life. Here's another checkpoint. How does role modeling help a participant with problem solving? Is it helping a participant understand how to problem solve in day-to-day life? Or modeling allows a participant to copy how a clinician acts, or it shows a caregiver how to communicate with a participant? The correct answer is role modeling helps a participant understand how to problem solve in day-to-day life. So here's a case study of a real-life My Choice participant who received this model of care during our pilot study. Prior to receiving care, the participant had been in the My Choice program for over a year. She was a 56-year-old female who lived alone in a house with a history of being outside walking, and she didn't realize the train was coming, and she did not move in time. So she was involved in a pedestrian train accident, resulting in a left shoulder injury and a right below the knee amputation. Upon assessment, she had home-delivered meals, CLS for IADLs and ADLs, and a life alert. She had a prosthesis, which she had used initially, but was not using anymore, and was frustrated and irritated with everything, not being able to work or get around or take care of her own needs. Her goals were to improve her ability to care for herself, her mood, and reduce her pain, and begin using her prosthesis again. Here is her person-centered service plan. She wanted to improve her ADL, IDL tasks, her mood, modify her home, have better pain management, and refit her prosthesis. Again, these may seem like needs that could have been addressed previously in her My Choice care, but notably, she had not received them at the time this model of care was implemented. So the participant was frustrated and irritated. The RN, OT, and social worker met in the home of the participant to problem solve how to increase her independence, and then brainstormed on home modifications and devices to assist with ambulation. The OT role modeled how to contact the prosthesis vendor for refitting so that the participant could independently do that in the future if needed. Working together, all four of them as a group, including the prosthesis, they were able to have her begin using her prosthesis more frequently. She was able to wipe herself better and go to the bathroom independently and recover her dignity. And she attained greater stability when using her walker. In summary, problem solving, brainstorming, and role modeling provide ways to help participants to maintain independence at home. Thank you.